we need a scheduling template for consistently productive days. Aaron, there's a massive difference between being busy and being productive. You can be busy where at the end of the day, you literally feel like a truck ran over you, but then you look at the day sheet and discover you didn't produce enough to cover the light bill. Or you can be productive. Busy and productive don't mean the same things.
Right.
And what happens in many practices, this isn't the intention, but somehow scheduling has degraded to this point. Scheduling is an exercise of just filling in names in blank spots in your schedule. And if you're filling in names in blank spots, you are not going to end up with consistently productive days. I think of consistently productive days as something that we engineer. It's something that's engineered. It's designed. And if you simply follow the design, you get the end result. So one of the things you could do, doctor, is determine how many blocks of what I like to call rock blocks. Rock is a slang term we use for productive appointment time. How many rock blocks do we need in your schedule every day? And if we fill those with the procedures that create more production in our practice, and you fill those first, you're now making big steps towards engineering more productive days. And so I would use blocks. I'd use a 48-hour release, meaning that if you haven't been able to schedule with something ideally 2 days before, then you can release it and schedule it with the most productive thing you could put in there. But it's going to mean that we're not going to leave blank holes in the practice. But by scheduling these rocks first, and here we are as this is being published in August of 2023, doctor, go through the rest of the year and put those rock blocks in every one of your work days for the rest of 2023. And then while you're at it, go out and put them into 2024. Now, you're not going to have any patients' names to go in those blocks yet, but you are going toward a big step towards engineering your days because you're putting those in first. Let your team members know what procedures can be put in the rocks. If they don't know that, then it might just degrade back to filling in blanks, filling in names in blanks. One more tip I'm going to have in terms of a scheduling template. It would be very useful for you to define a specific doctor scheduling coordinator in your practice. If you have multiple admin team members and everyone is scheduling, then very often you can have the situation, you've heard that slang phrase, too many cooks in the kitchen.
Right.
You can have too much chaos going on. And so if you have a doctor, it doesn't mean that your other team members can't make doctor appointments. Of course they can. But I want one person responsible for the doctor's schedule. That person has accountability and responsibility for scheduling doctor to goal.